Hi, everyone, and welcome back to Beyond the Dental Chair. I'm your host, Brittany Murphy, the myohygienist, your guide to thinking outside the box, expanding your skill set, and making a bigger impact on your patient's overall health. Today, we're going to talk about something that we've all seen in practice, but might not always connect to airway health, and that is a strong gag reflex. How many times have you had a patient gag while you're taking x-rays or using an intraoral camera, or even just during a routine cleaning? While we might be used to this as a response, an overactive gag reflex is often a red flag for airway dysfunction. So, in this episode, we're going to explore why this happens, how it's connected to airway health, and most importantly, how we as airway focused professionals can use this information to better serve our patients and incorporate it into our screenings. So, let's get into it. As registered dental hygienists and or myofunctional therapists, we all know that the gag reflex is a protective mechanism. It is controlled by the glossopharyngeal nerve, which is cranial nerve 9, and the vagus nerve, cranial nerve 10, and exists to prevent choking or aspiration. But what many don't realize is that an overactive gag reflex often signals dysfunction in the oral and the pharyngeal muscles, which are closely related or tied to the way that we breathe. In practice, we see patients who have, again, that gag reflex upon either x-rays, routine cleanings, maybe you're taking an impression. They can't tolerate, you know, brushing their tongue or using a tongue scraper. Maybe they have issues swallowing pills or swallowing certain textures. And while we might, excuse me, chalk this up to hypersensitivity, in many cases, it's actually their airway that's screaming out to us, that's telling us, alert, alert, something's off. And this is where our role as airway focused providers becomes so very important. So, how exactly does an overactive gag reflex connect to airway dysfunction? There are a few key reasons that I want to go over today. So, we have compensatory muscle overuse. Patients with airway issues, like a high narrow palate or a tongue tie or nasal congestion, they overuse their pharyngeal and soft palate muscles to help maintain that open airway. And this constant tension can make that gag reflex hypersensitive. Now, we all have a gag reflex, right? But we just want to know, is it overactive or is it within normal limits? Low tongue posture and restricted tongue mobility. If a patient has a tongue tie, or let's just say their tongue is habitually resting low in the mouth, they lack that proper oral stabilization that's needed for airway function, for good airway function. And the body may compensate by increasing throat sensitivity, which leads to that overactive gag reflex. Mouth breathing and sensory overload. Chronic mouth breathing, we know, dries out the oral cavity and the throat, making tissues much more sensitive. Patients who mouth breathe often have a heightened gag reflex because their airway is usually pretty irritated. An undiagnosed sleep disordered breathing issue. Many patients with obstructive sleep apnea or upper airway resistance syndrome experience airway collapse at night, and their nervous system compensates by increasing airway protective reflexes, including the gag reflex. Neurological overstimulation. The glossopharyngeal and vagus nerves play a huge role in airway protection. When the body perceives airway instability, these nerves become hypersensitive, intensifying that gag reflex response. As dental professionals, we see these signs on a daily basis, and recognizing them can really be a game changer for early airway screenings. So, what do we do? How do we take this knowledge? How do we use it in our dental hygiene appointments and myofunctional therapy evaluations? Here are key few ways that airway screening, how we can incorporate them into our airway screening questionnaires, and different signs to look out for. So, when a patient gags excessively, you want to ask the right questions. Do you breathe through your nose or your mouth most of the time? Do you have difficulty swallowing pills or swallowing certain textures of foods? Do you snore or wake up tired? Do you get frequent headaches? Do you clench or grind your teeth? Then we want to look for structural signs. So a patient with a high narrow palate, scalloped tongue, or restricted tongue mobility is at a much higher risk for airway issues. We want to observe their breathing patterns. Are they mouth breathing during their cleaning? Do they struggle to breathe comfortably while reclined? Watch the way they breathe. Where are those primary movements coming from? Do they look like they have a bit more of a shallow breathing pattern? Is there a lot of movement going on, in the shoulders, rising up and down very close to the ears, right? We want to have more space between the ears and the shoulders. Yes, a little bit of upper chest movement is going to be normal, but most of that primary movement should be coming from our diaphragm or that rib cage area. Pay attention to their swallow. If a patient has difficulty swallowing their own saliva, or if they exhibit an exaggerated swallow pattern, this could indicate poor tongue function and airway instability. And simple screenings like this can help us catch airway dysfunction early and refer patients for further assessment. And there's simple things that we can be doing in our operatories. Now let's talk about how myofunctional therapy can help patients with an overactive gag reflex. As airway focused providers, we know that the gag reflex isn't just about desensitization. It's about fixing the root cause. And that is where myofunctional therapy comes in through tongue and soft palate strengthening. So these exercises will help to improve the tongue's mobility, strengthen the soft palate, which will in turn help stabilize the airway and reduce the need for that compensatory muscle activation or overuse that leads to that gag reflex response. Oral desensitization technique. So these are important, even though, again, we want to get to that root cause. What we can do is work on gradual exposure to help retrain that gag reflex so that patients can better tolerate things that are uncomfortable for them, like certain dental tools, dental procedures, impressions, toothbrushes, different textures when they're swallowing, pills, etc. Nasal breathing training. So, teaching patients to breathe through their nose helps to reduce oral dryness, throat irritation, and that's going to help calm that hypersensitive gag response. Swallowing therapy, so helping to correct dysfunctional swallowing patterns, relieves throat tension and prevents the overuse of those pharyngeal muscles. And it's pretty crazy. Many of my own patients have seen huge improvements in their gag reflex, along with, of course, things like sleep quality and really just overall airway function, just by implementing these simple strategies that we spoke about. So again, if you're seeing any of this, what is the big takeaway? As myofunctional therapists, as a registered dental hygienist, we see this dysfunction firsthand, right? We are on that front line, sometimes even before a doctor or a sleep specialist even does. So having the ability to recognize these signs and symptoms, being able to recognize that a strong gag reflex can be linked to a potential airway issue, or again, let it be known that it is a red flag for an airway issue. We have the ability, it allows us to screen our patients more effectively during routine cleanings and exams. It allows us to educate our patients on how their gag reflex ties into airway health. We then, now that we know this, if we aren't a practicing myofunctional therapist, that RDH can refer them to a myofunctional therapist for, all of that tissue strengthening, nasal breathing reeducation, and further airway assessment. Now, if you are a RDH or a myofunctional therapist and you are passionate about airway health, which I know if you're listening to this, you already are, this is a conversation that we really need to be having more of in this industry. We have the power to change lives by catching these issues in general, but especially early. So I'd love to hear from you. Have you noticed this connection between airway dysfunction and an overactive gag reflex in your own practice? And let's continue the conversation. You can reach out to me on social media. You can email me. Always feel free to join our online community. And please reach out with any questions or any topic suggestions that you ever have. If you found this episode helpful, please don't forget to share it with your colleagues and leave a review wherever you are listening. And until next time, let's keep thinking beyond the dental chair. Take care and keep inspiring.